The type of conditions that epidural steroid injections treat is radiculopathies or pinched nerve coming from the neck or the low back. If a disc is herniated or protruded, it can irritate, it can push on a nerve and cause irritation. Therefore, sometimes people will get numbness, pain, tingling in the extremities. Sometimes they'll get the full spectrum, sometimes they'll only get part of the spectrum. So the epidural injection really helps us to reduce the inflammation and then therefore reduce the pain associated with the condition. An epidural injection is done under fluoroscopic guidance or x-ray guidance, meaning live x-ray. And what we do is we place the needle right around the nerve that we suspect is causing the pain. And we give a little bit of dye or contrast to outline that nerve root to make sure that we're in the right spot before we ever inject anything. Then we give the medication. The things to expect from an epidural steroid injection is you probably will have a little bit of anxiety beforehand, but our nurses do a great job of walking the patients through. Patients will come in for about 10-15 minutes before the procedure. Our nurses will take their vitals and talk to them and really do an assessment on them. We bring them back into the fluoro suite where the x-ray is at. We lay them down on the table facing downwards. We prep the area, we keep everything nice and sterile. Initially they'll feel a little bit of a stick, of a burn, and that's usually the numbing agent that anesthetizes the area. Then we use the needle under x-ray to make sure that we're in the right spot before we ever inject anything. We give a little bit of dye, it outlines the nerve root that we're looking for, and then we give the medication. After the procedure, the patient's taken back to the room. They'll be there for another 10-15 minutes to make sure that the blood pressure, everything's okay, and then we give them post-op instructions. The patients usually follow back up 2 weeks after the procedure. The advice that I have for patients considering epidural steroid injections is that it really is a safe procedure if done correctly. We really do take into consideration what is the pain generator. We also take into consideration what other treatments that they've had before. If they really are a good candidate for an epidural steroid injection, we go over the risk and the complications. After the injection, really for 2 to 3 weeks, we like the patients to take their time and to really not overdo it at all. And then on follow-up, 2 to 3 weeks after the injection, we discuss what is the next step. If they're doing a lot better, then usually we'll release them to physical therapy to continue a core stabilization program. If they're not making any progress, then that's when it's time to consider referral to a spinal surgeon.